Hi, my name is Kate McGravey. I'm the Executive Director of Ohio State Legal Services Association, and I have the honor today of introducing Anne Rubin. Anne was previously the managing attorney in our Athens office for many years, and also a legal services attorney for many years beyond that. I've had the pleasure of knowing Anne since 2008, when the Legal Aid Society of Columbus and Ohio State Legal Services affiliated together. Through my time with Anne, I've had the pleasure of working with her on individual cases, of talking with her about the work that she's doing, of working with her on our statewide and office team related to health and public benefits, and I've always been incredibly impressed with her work. Anne always cared deeply about our clients, about our mission, and about the health of those in the community around her. You would see this with the individual countless cases that Anne did throughout her career, representing low-income individuals on issues of Medicaid and other health-related issues, both at state hearings and all the way to federal court. Beyond those many individual cases, however, Anne was also very interested in how else we could get at the root causes to help improve the health of our communities. Anne was in the inaugural class of Health Justice Fellows, nationally with the Center for Medical and Legal Partnerships. She established a medical legal partnership in Athens that was focused on working with individuals with diabetes. She was also part of IPAC, which was Integrated Professionals and Appalachian Children, which brought together medical providers, attorneys, and educators to deal with systematic issues around health. What impresses me the most about Anne now and always has been her creativity and her consistency. And so it was always a pleasure for me to see how she would address an issue, how she would approach something as it came about, and decide what tactics to take on that. The impact for Anne continues in our Athens office, even though she is no longer there on a daily basis. But that approach, that creativity, and that dedication, you can still see in our staff attorneys who are there now and the managing attorney that's there now. Beyond that, Anne had an impact on all of the staff in our program, and her dedication to health and to our clients certainly lives on through all of them. It is my honor, on behalf of UHCAN Ohio, to proudly honor Anne Rubin.
Hi, let me start by thanking UHCAN for this recognition of my career. Thank you, Kate and Jean King, for your generous nomination for this honor. Also, let me thank Ohio State Legal Services Association, Southeastern Ohio Legal Services, for supporting me throughout my career as a legal services attorney. I worked almost 40 years here in Southeastern Ohio, which is part of Appalachia. Here, poverty and unemployment are higher than in other parts of the state. You might sometimes hear someone say, well, I don't have much, but at least I have my health. But that's not necessarily true here in Southeastern Ohio. Hand in hand with poverty are high rates of diabetes, cancer, and disability. 3 of the 6 counties bordering Athens have no hospital located within the county. So there's still a lot of entry points for advocacy around healthcare access and equity. Thankfully, there are a lot of dedicated advocates at Southeastern Ohio Legal Services to carry on the important work of instigating change. You asked me what motivated me to make a career almost 40 years at Southeastern Ohio Legal Services. Well, let me share 3 reasons. Probably one factor was being raised by parents who strongly valued community service. Another factor, honestly, I have to admit I like the thrill of winning a battle that really means something. Reversing a Medicaid denial for an uninsured poor person with cancer means access to medical treatment and hope. Winning an eviction for a pregnant, recovering addict means that a child can come into the world with a roof over her head and a chance to grow and thrive. Changing a restrictive policy limiting Medicaid coverage means a population can access newer, more effective medical treatment and better health. Finally, Practicing in a program that grew out of Legal Services Corporation meant that I was part of a large national network of anti-poverty colleagues and advocacy, which can be very powerful. So I've shared a little bit about the impact of my work on others. Let me close by sharing how the work impacted me. I've experienced a great joy in life of connecting with hundreds of people, colleagues, clients, agencies, providers, and academics who were really wonderful. I will always remember certain clients who had worked hard all their lives, got sick, hit hard times, and I met them in what would be the end of their lives. They were the salt of the earth. I will remember many people I've met in other professions who were truly visionary. I will always remember and hold those memories close. The many coworkers and volunteers at Souls who shared the dream and the work to make the dream happen. So thank you all.